Dr. Sith by recommending this topic. So a topic about disease investigation. So, and also he asked me to emphasize and to give what we know about the current outbreak of the H5N1 in dairy cows in the United States. So this presentation is a combination of presenting the disease investigation principles and the procedures, but also demonstrations of the principles and the procedures using the H5N1 outbreak in the United States. I would like to indicate here, like I purposely did not include a lot of slides, and the slides, I will share them with Dr. Sith after this presentation, and I hope like he will share it with all of you for further discussion if you would like to. My reason to have very few slides, because I would like to have your inputs through either when I ask questions, so you could maybe give me some responses, and don't worry, and there is no wrong answers, okay? And also I feel like you could ask questions during the presentation and keep the slides as much as possible just for the outline of what I would like to talk about today, okay? If that will be okay with you, I really would like to hear from at least two of you just to check on the system to tell me yes, so I know that I could hear you, but also I know like you could ask a question when I go through the slides. Somebody should say yes.
Yes, Mo, we hear you.
Oh, thank you,
Thank
Dr.
you.
Montanina. Yes, okay. So to start with, as usual, I would like to give some definition about what we mean by some of the terms here, because that will really keep us all together using the same terms and knowing what we are talking about. So when we talk about what we call an outbreak, it's mainly sometimes is referred to as short or short-term epidemic, and is mainly a series of events, usually like health events, that are clustered in time and space. That's where the meaning of an outbreak. Most of the time, this is related to new cases, okay, that occurring beyond or higher than the frequency observed, okay, or known in relatively like either historically or also to know by the same year or whatever in that way. I will elaborate on this when we discuss and when we present the epidemic curve to see what's the meaning of outbreak in that way. When we talk about disease or outbreak investigation, what we mean here is mainly a systematic procedure to identify causes, sometimes we call them determinants, and the source of the epidemic, and to answer one or more of the following questions. What is the problem? Okay, and here we talk about, of course, health problem. What's the immediate steps be taken to as intervention to deal with the problem? And then we could have also to look on how can in future cases be prevented, okay, from occurring in the same population, and what's the likelihood of the source of the infection. And when we talk about infectious diseases, but it doesn't have to be in infectious diseases. What's the exposure in sometimes with a toxin or other areas of health event, and 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 have other hairs become infected, like how extent is the problem in that way. And when we look all of that, is especially among the people who are working in the public service, like government, or even with some of the international agencies. The next one is this disease is notifiable? Because that will fit a different categories, and that will require maybe further action in addition to what we deal with. As I said, and I would like to emphasize, it's not necessary any of this investigation to answer all of the above questions, but sometimes we will have more than one to answer it in a disease investigation in that way. What I would like to, for this slide, is mainly to emphasize on, sometimes we call disease investigations, other time we call outbreak investigation. Most of the time we follow and say, well, outbreak investigation. In my opinion, that is in the veterinary side, we usually deal with disease in general in that way. Let me give a little bit reason for my using the disease investigation in a state of outbreak. First of all, when we said disease investigation is much broader than an outbreak, and that will give some ideas. And sometimes, especially in a country like Thailand or other Southeast Asia, when you have notifiable diseases and you want to investigate, most of the time they are not an outbreak. They are like occurring, and you need to go and investigate for notification and clarification. So that the term disease investigation will be more fitting in that way. And when we talk about investigation, the essential component for it is in the animal health program or a surveillance, we incorporate that as part of the procedure. So it's that another reason to use the term disease investigation in a state of an outbreak. Is mainly why we use outbreak investigation, because it's mainly is used for good reason in the public health arena. And that I really don't think is we need to change it. But when we come and talk about the veterinary side, we need to be very careful on how to utilize that term. And furthermore, and just even though I spent the last minute talking about that, I don't really care about labeling. It's mainly we should focus on the concept, because the concept is the same whether we talk about disease investigation or an outbreak investigation. As I indicated in the previous slides, is mainly to respond or answer some of these questions being addressed in that way. So what's the principle for disease and outbreak investigation? The most important promise that cases of diseases are not clustered, or excuse me, are not distributed randomly in a population. Rather, they are clustered by a specific pattern. If I usually say that, okay, and I will refer to this statement, if the disease or diseases are distributed randomly in a population, you and I will have no job, because that it's really like it's random distribution and nothing we can do with that. Okay, so it's most of the time, or actually all the time, diseases are clustered. Okay, and these clustered has a specific pattern that we need to investigate and find a reason behind it. The other principle is the etiology, specifically for infectious diseases, or sometimes what we call necessary cause for non-infectious diseases, by itself is not sufficient to cause a disease. There is a need for what we call other factors, and that's where it's usually we come to and what we call the determinants for the causes. Okay, I hear some noise. Is that question or somebody had like talking with their friends or whatever? If you have a question, please, either you use the raise hand or stop me and I will be glad to stop and listen to your question. Okay, so when we talk about the investigation is mainly because we try to understand what we call like the specific underlying hypothesis for the patterns of these diseases. As I said, these are we call sometimes determinants, sometimes we call causes, and sometimes we call factors associated with the disease. In my opinion, especially in the field, all of these three terms mean the same thing in that respect. Okay, so when we talk about the methods for outbreak investigation, there is what we call the checklist of 10 items, okay, that we should consider in investigating when we have an outbreak or a disease. These 10 checklists are mainly, like I will say, is the necessary steps to follow, but not all the time. You need to have all the 10 being like addressed. I usually, and I will say that from the beginning, I use the 10 checklist when I am almost thorough with my investigation to indicate if there is anything I missed during the investigation. So, as I said, you could sometimes either you run them simultaneously, some of these steps, but sometimes you could maybe skip some of them for a good reason in that respect. So, as with the request from Dr. Sith, and I agree with him, and I'm thankful for his suggestion, I'm planning to address this outbreak of the H5N1 infection in US dairy cows, and mainly for two purposes. First, to demonstrate the required task for the checklist, but the second thing, which I think is very important also, to give you some ideas and about this ongoing outbreak now, and how much we know and how much we don't know. But to start with, I would like to say is, and so as a disclaimer from me, I am not doing the investigation for this outbreak. I am trying to be informed, but I am on the marginal of being informed in that way, mainly because I have like two colleagues who were former graduate students of mine. They were assigned by USDA to do the investigation, and I've been talking with them, and mainly to get as much as possible without jeopardizing on the confidentiality and the scientific aspect, and to get these things. So please don't consider like I am the specialist or the expert in knowing what's going on now. In my opinion, nobody now has complete picture of what's going on with this outbreak. However, it's a good model or a prototype to show you the 10 steps and how it can be used in this situation. So the next slide is mainly is the first step, and I will go through each of these steps, and with some of the elaboration of what do they mean, and then I will give a little bit about how it's related to H5N1 in dairy cows. Okay, so when we said verify the diagnosis, it's in any disease investigation, there is a need to verification of the cases. Okay, that doesn't mean it's not only the laboratory, but there is a need to know about the historical background about the cases, and also to know how to verify if there are really like occurred or just like by sometimes, and I would mention it in the next step, sometimes it's just mainly by somebody with impression there is an outbreak and need to be considered seriously in that way. So, and for our knowledge so far and historical information, okay, this the H5N1 is started actually in January, and some people even think in December, but it did not get attention of the like the especially the public, or excuse me, the animal health people until February, in which like they identify through the testing and that there is H5N1 strain of what is called the high pathogen AI in affected cows from at least 10 states. I should mention in the beginning, there were not 10. It's in the beginning, there were only 2 states, and then start to be accumulate. And currently, I believe around 11 states involved in that way. Most of these cases were recovered within 2 weeks. And if the cow is culled, because usually, like if the dairy farmers will, or the manager would know the cow is reduction in milk, okay, or sick, then usually they send it and cull it, and mainly because for management and financial aspect, okay, but they are culled because of the reduction in milk production, okay, and that by itself led to get the attention of a private practitioner in Texas to say, well, let's look what's going on in that way. So that's the first step. And when you look on the history and how you could verify the diagnosis. So my question to you now, and I need maybe some of you to give me yes or no, do you consider this an outbreak that worthwhile to be investigated, and why? Please try to help me. This is the end of my day. And it's night, it's almost 9 o'clock, and so please keep me awake. Don't worry about the English. You could speak in any language.
I would say yes, because of the differences in the epidemiological characteristics. It's an unusual host.
Yes, yes. And another thing, you're absolutely right. Okay. You're Johansen, is that right?
Yes, thank you.
Okay, thank you. And the other thing is, if you look from the characteristics, what we know, this is first of all could be a public health hazard, and it was not known to cause any illness, okay, in ruminants. So that by itself, you get the attention and you get the red flag, like there is something you need to investigate. Thank you for your response, okay? So the second step is the define a case. In my opinion, this is the most important part in any disease investigation, okay? is different than when you do epidemiological studies like case control or cohort. With the definition, as you could see, is you need to have a very broad case definition. And as soon as you start to investigate, you narrow the case definition. Whereas in epidemiological studies or observational studies you conduct, you have one definition and you stick with it all the way to the end. Here is you will be in a position you could change it as much as when you get more knowledge about the disease that you are investigating. So for this purpose, I thought like I will give you some ideas about the clinical signs being observed, okay, with these cases. Is mainly show as mastitis-like milk, is mainly like the colostrum, is thick, okay, is elastics in some way, and bluish in color, which is very unusual. Even in mastitis milk, you don't see the blue color in that way. And there is a reduction in the rumination, which means like the cow is sick and there is fever and will lose the appetite, so off feed and substantial decrease in milk production. Actually, the first few cases, they almost stop any type of lactation during that time period. I should mention here, and I really would like you to pay attention to that. In the beginning, some of the private practitioners, they were saying cows will have influenza-like symptoms. What do you think wrong with that type of labeling? Influenza-like symptoms in cows. Can anybody tell me what's wrong with that type of characteristics of a disease in animals? No?
If I had to guess, is it because you expect the idea of influenza-like implies that you assume certain biological characteristics about the host as well, like the ability to sneeze, the ability to cough. So you restrict your case definition to that.
That's a good point. That's really good point. But let me ask you, since you volunteered, and I really appreciate that, do you think animals can have symptoms?
Not by the strict definition of symptoms, which is something that is subjectively reported.
Animals will
Right.
not show
Yeah.
symptoms because symptoms means they can talk. They can
Yes.
tell you I have fever or I cannot eat, okay? And that's where we said symptoms. So it should be clinical signs, okay? Then something that you need to consider. And when they say influenza-like symptoms, what do you expect? Sneezing, okay? Coughing, okay? And that part of the influenza-like symptoms in humans, okay? What you expect in a cow when they eat? Usually they sneeze, they cough, but that's part of their normal, like I would say, behavior when as a ruminant. So I really like, and I try to correct that way back the practitioner, but also I understand why she said that at that time. So now my other question, how do you define a case? If I give you the above description, are these disease clinical signs are unique for this outbreak? Are they unique for this disease? Yes or no? Don't be shy. And no, as I said, no wrong answer. Okay, what do you expect if you have systematic mastitis, what sometimes we call coliform mastitis? The cow will have fever. The cow will have like off feed. The cow will have reduction in ruminations, okay? And the cow will have a decrease in milk production. This is one of many, many diseases that we expect in dairy cows in that respect. So here is like, I feel like this is very broad, but we know this is like a case that can be considered. I will go back what I said before. The definition of a case should be broad enough now, and then as soon as you move with the investigation, you could determine and to say how we can reduce that case and make it more specific. This is directly related to what we call the overall sensitivity and the overall specificity when you deal with a system or an investigation in this situation. So the third step is determine the magnitude of the problem. And what I mean by the magnitude, is it really an epidemic? Is it really an outbreak? And you already answered that by saying, yes, we feel it is an outbreak, mainly because, as you said, like, this is unusual, okay? And you find it like is above what we are expecting in terms of the frequency of this type of outbreak. And here is what there is an analytical tool that it can be used, what we call the attack rate, okay? And the attack rate is mainly is measure of the incidence by computing according to the following formula. And that's mainly is used in a disease investigation as I will call it like a special incidence rate in that respect. Why special incidence rate? Because the denominator is considered all of the animals at risk for that particular event instead of on taking the average in that way. However, the numerator is the same as any incidence rate that we be known. So, given what I give you the description, okay, and for the case definition, which animals are at risk, okay, given the above description? If you are investigating this disease and you want to estimate the attack rate, okay, as a rate, okay, what you consider your denominator in this situation? All the animals in the farm, okay, only the lactating cows, or a specific age, or a specific house? Which one you consider the animals at risk for this situation, given what I gave you as far as the case definition?
Would you start as broad as possible and narrow it down over time?
Excellent. Okay. I did not mention in my previous slide, and is the cases are only found in lactating cows only. And so far, by the way, no other age group or production type like dry cows or calves or replacement heifers, none of them will suffer from this type of disease. So this is where I agree, like it could be, like as you said, I could look at for the broad and actually that's what happened. But also they look on, let's call it attack rate by specific group. So there is an attack rate where for dairy cows, there is an attack rate for calves, an attack rate for dry cows, in which each of those, the denominator is related to, for example, for calves, on the total number of calves. For dry cows, only the total number of dry cows. Fortunately, well, unfortunately, depends. The numerator for the calves, dry cows, and even for replacement heifers, the numerator is 0. So immediately, now the focus on attack rates among dairy cows or lactating cows, in which like the total number of animal at risk, only the total number of cows that are lactating. Okay, so that's how in this situation, which is very special, okay, that's how they focus. In addition to that is that immediately when you do that and you have 0 attack rates for these different classes of animals, that will give you and let's call it like a red flag, like there is a risk factor here. And that will give you some ideas that, or some hypothesis what's going on in that respect, which I will indicate for that. So if we do that, and I already mentioned to you, now, if I am investigating in more than one dairy farms, okay, in more than one farms, how do you think I should compare, okay, between dairy farms? Which attack rate I should take into consideration to compare between the dairy farms when they have certain outbreaks with this disease? When I said certain, like variable outbreaks, what type of an attack rate I should use here? Well, it seemed like either you are in early morning and you don't want to talk, or it seemed like maybe you cannot follow what I am asking, but then I will answer it now. Here is where you take the attack rate for the lactating cows, okay, because each dairy farm has a different number of lactating cows. So here you adjust the number of cases to the number of lactating cows, and that type of attack rate you can compare between different dairy farms. And this is now, it's being used because it's really the magnitude of the problem between dairy farms are different. And that led to to think about, investigate why dairy A has more or higher attack rate, okay, in their lactating cows as compared to dairy B in that respect. So that's what it's being done in that way. Okay, the fourth temporal pattern is the steps that we need to follow. That's the fourth one, okay? And when we said by temporal pattern, is mainly we are talking about here is the time, okay? And how these cases are distributed in time, and that will lead to the construction of what we call epidemic curves. And using the time intervals as the x-axis, and using usually the occurrence of the disease on the y-axis, is like in this situation the number of new cases in that respect. For our H5N1 in dairy cows, what do you think the best way to count for the time intervals? Because as I said here, time interval could be in hours or in days or weeks or even years, depends on how the disease, okay, and the characteristics of the disease and the definition of cases. Given what I told you about the case definition and the description of the disease, what do you think the time intervals here? You could consider hours or days or weeks. If you go to a dairy farm, I'm not talking about like among dairy farms, I'm talking about a single farm. What do you think is the best way, okay, to consider that in an epidemic curve? You remember I said cases recovered within 2 weeks. So in my opinion, the best way to consider days, okay, we see if there is any pattern for the spread of the disease within a dairy farm, okay? Or you could consider weeks when you try to compare between like different dairy farms in that way. And this is really will depend on, I like to call it like almost piece of art, but it has like some biological justification by knowing the history of the disease in that way. Regardless, what do you think the benefit from drawing an epidemic curve for a disease investigation? What this will help us with? What's going on with you? It seems like you really, I cannot get you to participate. It's me?
I think you
or
can
it's
see the. Oh, sorry.
huh? Go ahead, Jonathan.
The epi curve helps you to see the pattern of the outbreak, to see the degree of increase and decrease, and you can also assess like if it's a point source or multi-source, like where the transmission dynamics are coming from.
Excellent, excellent. It's mainly to help you in narrowing some of the hypotheses that you are looking for, okay? And as Jonathan mentioned, is like he mentioned two types of epidemic curves, like the common source or like maybe propagation, which I will mention in the next slides. I like to show the epidemic curve, let's call it the generic epidemic curve, and to show you why we have this and how they can really related to understand the disease spread, the disease speed, but also to identify if you have a common source or whatever. So in epidemic curve, we have what we call endemic level. Endemic level could be as 0 cases. You remember, like the x-axis is the time and the y-axis is the number of new cases or the percentage of new cases. So then we have what we call the ascending. The ascending will mainly show the speed of the spread of the disease within this population, whether in a one dairy farm or among different dairy farms. How effective the agent in spreading the disease among the population. So that will give you some ideas. And as Jonathan mentioned, this also will give you some ideas if there is a common source, because it will look like almost like a straight line. If it is propagated, is usually will go in a very slow moving, because it's propagation means moving between one cow to the others, etc. The plateau is mainly the period in which the disease spread and steady in the population, and is usually related to the susceptibility of the population for that disease or for the agent, okay, but also related to the moving animals in and out. So if you have a lot of that, that means you are adding susceptible animals all the time in the population. The descending, what happened here is the like
คือถ้ามา
going back to normal level or the endemic level. So that is, again, it depends on the intervention strategies. It can go straight line, very sharp, if you have a very effective intervention, and then we'll go back to the endemic level. But if you don't, usually we'll go in a very slow way, like in almost like a curve with 30 degrees or 40 degrees, instead of going in a curve with the 90 degrees in that way. Most of the time, this is where I want to emphasize, is what the area under the curve for the epidemic curves, okay, what we call the area under the curve. This is what we try to reduce by using preventive and control measures. The more effective the prevention and the control, the less area under the curves. The more or the lack of taking any action, this area of the curve will go up. Okay. So that's where, like, when I said, like, we talk about like a disease and the magnitude, this will be very important. Okay. Most of the time, including the H5N1, what usually when we don't get involved until the disease will go up. Okay, do you see my arrow or not? Do you see the arrow on the
Yes.
slide?
Yes.
Okay, yes. So
Yes.
that usually will go up. Okay, and most of the time we come maybe in the middle of the ascending curve, and the reason is because then you get the attention of the health group in that way. We used to say is, and if you really would like to be successful in disease investigation, you wait until the end of the ascending, because whatever you do, it will show you are effective. But that, in my opinion, is against the principle of being effective, because effectiveness means you reduce the area under the curve in that respect. Okay, is that clear about?
Yes, Mo,
Okay.
thank you.
Yes.
And
Okay,
and
so
actually, there are some response in the chat about epidemic curve. It's about the pattern and source of infection. Yes.
oh, okay. Thank you, Sid. Please follow up on the chat, because I cannot have other screen to show the chat. So if you have any more on the chat, please share it with me, and then we can start in that
Okay.
way. Good,
Okay,
good.
yes,
At
thank
least
you.
there is a response. Okay. Okay, so the next slide is mainly to show what's the difference between endemic and epidemic. You remember my first step, and when I mention is this disease is like an outbreak or not, is usually the endemic level is very low, okay, sometimes it's zero, okay, and like the current H5N1 in dairy cows is zero in Europe, for example, and they are looking, and we actively trying to find if this they could find it there. So it could be zero, it could be certain level, and then it goes up, and that's where we pay more attention in that way. Okay, the next step, number 5, is the spatial pattern, the location. And most of the time, I like to say, even though we have now a good tools through the GIS and good software to understand what's going on, I still like to have like a topographic map in which, like, even by paper and or by putting some dots in different colors on like real map, because that will give me some ideas about the spread in that way. I'm not against the GIS, but it just really like would not add more than if I could see it physically on a map. I would never forget, okay, I was involved in the FMD outbreak in Uruguay, which occurred in the same year that the famous outbreak in UK. And I was in there what they call operational room, and they have a map of the country, and they have different colors pins, and they were showing to me what's going on. And the first question I had, I'm mentioning that to you because it really showed like how it can be very effective. The practice in Uruguay to have sheep and cattle together in every farm, okay? At that time, we know the main spread of the FMD virus in UK was sheep. So I was trying to tell them, okay, let's focus on the sheep because they were doing vaccination in a state of depopulation at that time. And they told me there is no reason to vaccinate sheep and there is no reason to cull sheep. And I said, why? And it's through the map. They have a color for herds with sheep and cattle, and they have a different color for cattle without sheep, and they have another color for sheep alone. And they showed me in a very simple way, like sheep will have nothing to do or no role in the spread of the FMD, and clinically, they did not show any clinical signs in that way. So that's where I really think is sometimes you need to be careful and you need to inspect as much as possible the interrelationship among cases and between location and other physical features. For the H5N1 in dairy cows, okay, what do you think the best map to show the geographical location of cases? Think about that. I told you currently there is between 10 to 11 states in which they are involved, okay? So what type of maps you could show? I'm not talking about a given state on a national level. And you know, we have 50 states, okay? So what do you think the best way to show on a map, okay? Let's call it topographical map about the cases by these states. You can put it on the chat if you feel shy and you don't want to talk. Okay, usual way is we have like 48 states. They are what we call is in one location, and the other two states, Alaska and Hawaii, is like separate from these 48 states. So as we had done before with brucellosis, with the tuberculosis, a map of the 48 states in which like you can put the cases by each of these 10 or 11 states. Now, I have another question I would like you to consider. So what other data you need to include or incorporate in the map? Let's call it a map of the 48 states, okay?
Okay, Mo, the first questions, there are some answer in the chat, like the heat map and colored map, and the general
yes.
map of the USA. Yeah, and we are waiting
good.
for the second question.
Yes. Well, I'm sorry, I'm not giving you time, but maybe I should wait until you respond through the chat. Very good. Okay, what about the
Okay.
second question?
Yeah, the second question, Jonathan, again, he mentioned about the highway data. Could consider visualize that because the early suspicion was transported across states. Yeah. Yeah,
Okay.
and another answer from Dr. Wang, proximity to each dairy farm within each state, and also the cattle density.
Ah, I am so glad, and especially the last piece of information, cattle density. As you know, like there is variability among these states. Okay, so when you said cattle density is, I will be more specific to at-risk cattle. So I will have an idea about and I will mention two states, and that's of course available through internet, Michigan and Colorado. Okay, Michigan has a different number of lactating cows as compared to Colorado. Okay, and the other one, which was a good response about the approximately to each of these dairies. Like in Colorado, we have a Rocky Mountains chain, which divide the state into west and east. And majority of these dairy cows are on the east side of the mountains. And proximity to them will be very important. And what they have done, these epidemiologists in the investigations, they put their proximity in by counties. Is we have a state, and each state will be divided into counties. Some, like you divided, like for example, Thailand into districts and region, and the same is here. So they put them in by county, and then you could see about the proximity. That's wonderful, wonderful response in that way. Now, I will ask another question. What do you think the added value from the map? You remember when I mentioned with the temporal pattern will generate some hypothesis. What can you give me one or two examples? What the added value from the map and or the spatial pattern?
Okay. Yeah, we are waiting for some answer by chatting, or even anyone can open the microphone also. Okay. That is the answer that can infer future risk. Yes, and some information on the spread of the disease. And
Excellent, excellent. Yes, is spread, and that will give some ideas, like with the H5N1, whether animal movement, okay, is a factor in spreading this infection. So that's another reason it can be done that way. I am running out of time, but if you don't mind, Dr. Sith, I will take a little bit more time to finalize the presentation, if that's okay.
That's okay, of course, Mo. Thank you.
Okay, yeah. So the next step is step 6, is you try to identify factors associated with the disease. And how do we know about these factors from the first investigation? Usually we characterize them by the agent, by the host, and by the environment. And I am going through some of the list here so you can have some ideas. And by the way, still this is not solid information. It just mainly is through the here to say an observation from several of the dairy farms that we are trying to figure out. So with the agent characteristics, you try to understand about the incubation period and the infectivity and the pathogenicity. In fact, and the incubation period, as you know, will be like how long will take from the exposure to the virus in this situation until you saw some clinical signs in the animals. Currently, they, by looking on the records, they think is around a week to 10 days. Infectivity is related to the dose of the virus, but also related to the, like, how virulent the virus. Hello? Okay, so that's not a question, I think. Okay, so, and there is, especially with this virus, the infectivity is not so high, okay, in animals and mainly in cows or ruminants in that way, and neither in humans. There are only few, until last week, there are very few workers who suffered from the same virus. Okay, CDC, the Central for Disease Control, investigated among more than 100 dairy workers who are in direct contacts with the cows and confirmed with the H5N1, and they found among them only 5. So it's not really highly infected in that way. And when you come to the pathogenicity, as I said, for dairy cows, okay, majority of the time is very mild, okay? However, there is case fatality, and case fatality could be between 2 to 5%, okay? So that's, again, another measures for the pathogenicity. In terms of the human exposure and human pathogenicity, again, is very mild. Is mainly what is called pink eyes, okay? And it's recovered within a few days. So it's not something like it can be fatal or whatever. The interest here is that the mutation of the virus that for the future, and that's getting the attention of the public health people, for mainly they are concerned if there will be some mutation. When we talk about the animal factors, the host factor, of course, we talk about the gender. Okay, here is, as I said, cows, okay, dairy cows, lactating dairy cows, and that's all. The age is mainly cows that they are producing milk, not like what they call first lactating heifers, but so it's only adult in that way. The purpose here is milking cows, and the breed is mainly Holstein. The problem with these factors, these are mainly is biased by the management, biased by the practice. For the gender, for example, majority of these dairy farms, they use artificial insemination, and therefore they don't have bulls to show if they are susceptible or not. By the age here is, again, is by the practice. They know when they inseminated what they call, when they inseminate the replacement heifers, and they know when they cull them. Okay, so that's, again, it's by the practice. The purpose is mainly for milking. So far, by the way, in all the investigation in beef cattle, okay, whether in the feedlot or in cow-calf operation, none of them showed any type of infection. And the breed is definitely because we have only one breed here that is dominate the dairy farms, almost 99% of them. Environment factors, this is very important. Feed, why we put feed for this virus? Because some of the dairy farms, they practice on feeding what they call poultry waste materials, is mainly from layers in which, like, they you know how the layers they are raised, and they throw a lot of their feed along with their droppings in under the housing, and that will be collected and pasteurized and then fed to the dairy cows. So far, there is a very small case control study, and they found like dairy farms, they feed poultry waste, have no significant difference in terms of the occurrence of the H5N1 as compared to those that they don't. Water could be contaminated, okay? And before I go to the water, both feed and water could be contaminated by wild birds, migratory birds, and we know these are carrying the H5N1, so that's potential for like couldn't spread of the disease. Air currently they are trying to collect samples of air samples from infected dairy farms to see if they could capture the virus as they had done with the poultry farms. So far, no, I would say, findings being released, so I don't know what could happen. The waste disposal is mainly the cow manure and how it could be contaminated. So far, what they could not really identify, let's call it significant level of the virus in the waste material. Housing, majority of the farms, they are what they call on a dry lot farms. And because of the dry lots farm, it's very hard to say housing can be an effective way. When I said housing in that way, also like is related to the air circulations, and especially if the milking parole could be like related to this aspect. Last week here in Colorado, for example, we had heat waves, and we have some poultry workers who got the H5N1 from poultries, but that's mainly because they were using fans to cool them off, and the fans were spreading the virus from the chickens back to the people. Again, with very mild cases in this respect. Okay, so the seventh step is, which I think is again very important, is where you could start to have operating hypothesis. Here where the science will come in the picture. So usually you develop more than one, okay, hypothesis, and mainly to indicate whether what kind of epidemic, as Johansen mentioned, either they're point or propagated epidemic, and also to identify the source. Is it common source? Is multiple exposure in that way? And the third one is to identify the mode of spread, either the contacts, is vehicles, vector, formats, and etc. All of these are currently incorporated in the H5N1 outbreak in dairy cows. Currently, there are several challenging questions. I call them questions, but it's mainly in terms of operating hypothesis. Some of them are already being stopped. I mean, I should say, like being approved, like they are not related, as I indicated, like the waste materials, the feeding, etc. All of them really like now is being like considered not like as part of the spread. But the source of the outbreak will give some ideas. Okay, currently there are some hypotheses is that whether it's related to the spread of the virus through the migratory birds, which they usually try to feed on some of the open air feed storage area. There is another hypothesis like the virus is mainly in the udder, okay, because they identified a receptor in specific epithelium cells in the mammary gland, and that's the very specific receptors for this virus. So the issue here, if it is only in the mammary glands, okay, how it will become systematic and how it gets to the mammary glands. There is some like hypothesis mainly through the milking machine, but the milking machines and the cluster they use is with rubber, and that will not be sufficient to introduce the virus. And as probably some of you know, like is usually they use disinfection between and milking the cows. So that will be, I like to say, is not really like a good solid hypothesis now in that respect. These are, as I say, some of the one I could identify. One thing is there was also some hypothesis like the virus was introduced through human workers, but that again cannot be sustained because is currently like if they do that, then you will find it first of all among the workers, but also you will find it equally distributed in the among the different age group and the production lines in these dairy cows. So the number 8 step is to conduct epidemiological study, and these are mainly to collect and analyze data to test hypotheses, and often use case control study. Most of the time they use case control study because that's in the beginning is the easy way to do, or they could do cohort study, or they do epidemiological description. If I may ask you, which should be the initial step in the data analysis, descriptive epidemiology or conducting epidemiological studies?
Descriptive first?
Descriptive. Thank you.
It seems
Yes.
hard to plan a study without knowing anything.
Yes, and also the descriptive will give you some ideas about which hypothesis can stand and which not. And that actually is currently USDA is doing that, and the data are maintained like confidential because not they don't want to share it, but because the media and somewhat I call like pseudoscientists are taking it and interpret it in their own ways. And I really am fed up with those type of people. So they are keeping it to say like until we have a solid interpretation and findings before they will release it in that respect. Okay, so step 9 is implementing control and preventive measures. This should be like what I call it before, the intervention to stop the outbreak, but also it could be like isolated of cases, or you do treatment or vaccination or public health education. And considering like this is a public health hazard with this outbreak, what do you believe would be the most effective intervention strategy at this stage of an investigation? Yes, no? What, do you have any idea? You could say we don't know.
The first one in the chat is isolation
of the cases. Good. Okay, but don't forget about the public health hazards. What you do with the workers. Don't forget, you cannot stop the production. You cannot stop the milk production. So what you do with the workers? try as much as possible to take all of the precaution, including like proper disinfection, a proper clothes, okay, but also mask, okay, and that mainly to reduce the potential for the spread. And that's where majority of the dairy farms now, okay, they have the infection. That's what they are doing. They don't stop the production, but they take this type of precaution, even though the number of human cases are very rare in this way. Then, do you think the intervention, I already answered it, should be implemented immediately or prefer to wait until the investigation is completed? Well, I already answered. You should start immediately with whatever you know. And you know, cleaning and disinfection would not hurt. So it will be much better to do it, even if the effectiveness will be very, very minor. And finally, you produce report. In my opinion, no job is complete until the paperwork is done. And the important that the findings of an outbreak be reported accurately, precisely, and presented to be done in a professional style. This is the reason I'm saying like USDA now is not releasing some of this because they don't want to give an impression is like they know the answer, but they are releasing some of the information as they come in that way. So how frequently should be communicate to the stockholder about this? In my opinion, should be as frequent as possible to keep them aware and what's going on so they could also participate in finding the solution. And it should not be wait until the end because it could be like will take months and years, but it should be released as soon as it will come. As far as I know now, the investigation team of USDA is working on publication of a manuscript that it can be shared with the scientific community, but they are trying to be very careful and precise in their answer. And that's what I have, and I don't think Dr. Sith will give me more time for a question and answer, but I'm willing to listen if there are some, okay? And I'm sorry it took more time because I was expecting you to support me and work with me, but anyhow, now I know like maybe we should use the chat from the beginning.
Sorry about that for the beginning. That actually there are some answer respond to you in the chat, but we did not. Yeah.
Oh.
Okay. But anyway, it's over time. But I think everybody is okay. Yeah. But we still welcome 1 or 2 questions in the chat or open the microphone, please. Okay. There is one question from Dr. Navneet. If poultry waste is treated, it will still be causing a spread of virus?
This is very good question. It's when you said it treated, that means like deactivate the pathogens or the microorganism, like either by heat or by heat and pressure. It's been done in that way. So when I said the poultry waste is fed to the cows, they are pasteurized, they call it, before they are feeding them. However, in the beginning, I thought, well, poultry waste, and especially if there is a high dose of the virus, here we talk about a virus. So I thought maybe some of the virus would not be deactivated through the pasteurization. I was wrong because I now with all of the, let's call it focus studies, they find like H5N1 will be deactivated through heat and the pasteurization. So I was more worried about in the beginning with the poultry waste about bacteria like Salmonella and E. coli, but it's because of the pasteurization, these bacteria are deactivated. What's the main route of spreading among farms? That's again very good question. If I have the answer or the let's call it precise answer, I think the entire U.S. dairy industry would be very happy with me. We don't know because in the beginning, and when I said there are some pseudoscientists from Europe that they said, oh, animal movement should stop, okay, because that's how the virus is spread. Well, it's actually a lot of or significant number of the dairy farms now infected with this virus, they had very limited animal movement within the state or among states. So by saying that, we don't have really evidence to stop the animal movement because there is no such indication that the spread of the virus is through the animal movement. My speculation is it's through birds and migratory birds, like similar to what happened with the poultry, by the way, here in the United States. Okay, but so far they could not identify how these wild birds will have the access to the dairy cows and why only dairy cows. The second question about why only dairy cows, currently the speculation and the hypothesis that the receptor for this virus is only in the specific epithelial cells in the mammary gland of the cows. So that may can lead to some indication like that's where the target, as similar to, by the way, with the H5N1 in a human, is the receptors is way deep in the lung specific cells. That's the reason we don't see the infectivity of H5N1 in human, whether from poultry or from dairy, is very high as compared to the poultry. The poultry has receptors all the way in several organs and several tissues. So that's the reason it's been more effective in that way. Okay, something unique about this, about the cattle strain of, or it's more, oh, let me read the entire, is that?
Oh, sorry, I can just speak it out if it's easier.
Oh, it's okay. No, I can see it now. Does it seem like the Colorado human case is more attributable to something unique about the cattle strain, or is more because of the heat waves causing the PP failure? Because I understand poultry outbreak has happened quite often in the past few years, and there were no human infections since 2022. You are absolutely right. And when you said the PPE failure, it's mainly is because of the, as I said, the heat waves, and for the workers, they start to use fans. And as you know, the circulating of this virus was high from the poultry, and it seemed that being transmitted to the humans. But even among those, as I said, CDC did, like they sampled, I don't remember, but I know more than 100, and only five of them were serological positive, and only three actually. That was last week. There were more this week, but there were only 3 that they had very mild symptoms, mainly pink eyes in that respect. But as I said, it's still going on, and we don't have all the answers in that way. Did I answer your question?
Yes, thanks for your answer. We're just curious
Yeah.
about the difference in the virus characteristics after moving into cattle. I think that's a big unknown.
Well, yes, this strain, okay, it's the 134.421, something like that. The code for this one is very unique, okay, and I can tell you, I'm challenging both the Europeans and the Americans here, is why we don't see this virus in other countries. So I really believe is may related to either the practice we do here or related to the pattern of the migratory birds. And I don't know which the answer, be honest with you. I mean, excuse me, with everything we know, this virus, okay, even though is a specific strain, there is no reason to say is related only to United States.
Yes. Thank you. Thanks for your answer.
Okay, so let me.
So Lorenta, would you like to ask something because you raised your hand?
Okay, yes, I like your cat picture.
Hello, Dr. Mo. I'm Loventa from the IC Jayapura, Indonesia. And I'm curious about what should we do to the dairy cow that infected with H5N1, because these are the new case and a rare case. I'm concerned to prevent the habit of panic selling or panic action from the farmer. That's always happened in our country when the animal get infected with some disease.
So you mean how you get rid of them, or how you use them for waste, or because they are infected?
Yes, I mean, what can we suggest to the farmer that if dairy cattle get infected with the H5N1?
Yes. Well, what they do now is, first of all, they will cull them, they will send them to slaughter plants, and they will mark them similar to what they have done with bovine tuberculosis and bovine brucellosis. They will take precaution, okay, in terms of the exposure to humans, and the meat is sold only as cooked meat, okay, is not allowed to be like used as, the American style in eating meat is almost like still with blood, okay? It's not like what you do in Indonesia, okay? So for that purpose is really being labeled in that way. Fortunately, there are not so many cases, okay? And some of the dairy farmers, what they do, they decide like not to send them to slaughter plants. They will put them as like what they call like in disposal carcasses, and those are really like, especially here in the west part of United States, they will be used with the cow manure to produce fertilizers. It takes 4 weeks for the entire carcass to be dissolved and will be powder and used for fertilizer.
And I'm still curious about, is there any compensation that
Yes. Oh, yes.
farmer?
Yes, the government is giving compensation, but also they are giving also some what they call economic incentive, okay, in terms of the loss of the milk production in these dairy farms. And I don't know what the formula, they have a new formula, and the US federal government, what they do, they have what they call a crisis fund, okay, and they release that. So they do have a lot of fund to handle this situation.
Okay. Thank you, Dr. Mo, for your answer.
No problem. Okay. Any other thing? Seth, do you see any question?
I don't think so. Actually we have a lot, but it's the because it's out of time, it's out over
Yes.
time. But for anybody who cannot join, who could not join from the beginning, you can see at the Facebook of the our program. It's the name is Regional FETPV. That's actually we live stream now on Facebook, but you can watch a retro. And also, if you have any question or discussion point, you can leave within the Facebook, and we will communicate with Professor Mo Salman about this also. Yes, and also we will share the slide via our Facebook also. Slide from Dr. Salman. Okay.
And thank you, Dr. Seth. And I want to indicate I am not really fond of using the social media, and I don't have an account, but you're welcome to share with them my email address, and I'll be glad to respond individually or in a group to any question related to this presentation.
Okay, of course, more. Yes, we will do that. And thank you very much for the speakers for the special topic today. I believe that the story from the another part of the world in the USA that demonstrate about the outbreak investigation step and the checklist that more share with you today will be useful for all epidemiologists who will not be the pseudo scientist or something. And okay, and thank you so much more for your time. At we know that this is the late night. Thank you very much again for contributing to the FETPV and our community of the epidemiologists in our region. Thank you very much.
Thank you very
You're
much.
welcome. And I wish good luck to all of you. Okay. Yes. Okay. Goodbye.
Thanks,
Goodbye.
everyone.